Good afternoon, Team Whiteman and the greater Whiteman community. I'm Colonel Seth Graham, the 509th Bomb Wing Vice Commander. I'm coming to you this afternoon as first in a series of virtual town halls we intend to conduct to hopefully answer your questions surrounding the ongoing situation with COVID-19. I'm going to say something I think you probably all already realize, which is we are living in unprecedented times. This is something that the world, our nation, and definitely our military have never had to contend with. And we're going to get through this together as a team and a community. Just 2 weeks ago, Admiral Richard, the commander of United States Strategic Command, was here and reminded all of us that strategic deterrence is the bedrock upon which all other national defense activities rest. And we here at Whiteman are a key and essential part of that mission. I think it's very important that we all remember that. But that doesn't just stop with our airmen, our government civilians, and our contractors. That includes our dependents and our community as well. As we deal with this evolving situation, we all have to remember that every action that we take could have a profound impact on our ability to conduct the very most important mission that our nation asks us to do. And we have a solemn duty as airmen of the 509th Bomb Wing to be ready to respond when called upon. That's a really good question, and I know that this is something that's very personal to every parent out there who utilizes the CDC and the Youth Center. Let me start by telling you that all the way from General Ray, the commander of Air Force Global Strike Command, down to our base leadership, we believe the CDC and the Youth Centers to be mission essential. We understand that you can't do your job when you're worried about where your children are being cared for. So as of right now, we have no plans to close either one of those facilities. We may be implementing some procedures over the coming days to further protect the kids and the workers at the CDC, and you may see those rolled out either today or tomorrow. There's a follow-on question you're probably asking yourself, which is, if I want to pull my child out, are there repercussions to that? And the answer is no. If you want to take your child out of the CDC right now, you can do that, and you won't be penalized or lose your spot at that facility. The short answer to that question is yes. This is a rapidly evolving situation, and our procedures and precautions are changing daily and sometimes even within the day. So the best advice I can give you is to check back regularly to our website and Facebook page. That being said, I completely understand that your ability to have access to medical care and specifically prescriptions is something very important to you. And it is our commitment here at Whiteman to provide that service for as long as we possibly can. The way in which we provide that service may change, but our commitment to providing that service to you won't. Right now, there are no changes to our policies on who can access the installation. That being said, I think this is really a question of could I versus should I? Could you bring guests on the base? You absolutely can. But should you? I'm going to say no. I'm asking you to restrict that access on your own. And let me give you just one example. In a couple of weeks, my parents are planning to come and visit me, and I'm going to have a hard conversation with them that they need to stay at home and not come to Whiteman Air Force Base. Base access for retirees remains unchanged. As you probably know, we set the policy for who can enter the installation. AAFES and DECA set their own policy for who can utilize their facilities. As this situation evolves, we will remain very closely connected with both of those entities to ensure you have the latest information on how their policies are changing. All that being said, I would ask that you exercise very sound judgment and only go places you deem are absolutely necessary. Social distancing is the #1 way we can prevent the spread of this virus. Recently, the Secretary of Defense issued a stop movement order for all leaves, TDYs, and PCSs. That extends through the 11th of May. That being said, every situation is unique, and there's no way that I can answer that question for every one of you on this video. So I'd ask that you work this through your chain of command so that you can better understand how this order impacts your personal situation. On one hand, we've been trying for a number of months and years now to build connectedness amongst our airmen. But we now find ourselves in a situation where we're asking everybody to practice good social distancing, and those two things are coming in conflict. I find it incumbent upon commanders and leaders at all levels to understand how this is placing stress on their airmen and to mitigate that as best as possible. But I also put on us all as a community to come together and to work through this as a team so we can come out the other side a better, stronger, more resilient Team Whiteman. We will be following the CDC guidelines for travelers returning from overseas locations. In fact, we've already started doing some of this. Just recently, Colonel Jeffrey Schreiner, the 509th Bomb Wing Commander, and Chief Master Sergeant Katie McCool, our command chief, returned from an overseas travel and are now in a 14-day restricted movement. So rest assured, we have plans in place to deal with all the overseas returnees, to care for their needs, and to ensure the safety and public health of our community. Thanks to all of you who have sent in questions. I know this is a confusing time and you have lots of concerns. Believe me, I have the same concerns. So please keep your questions coming. We look to address any of those questions, comments, or concerns that you may have and expect to do another one of these over the coming days.